Today we are celebrating safety as an organization across the country. Today we've also teamed with Spanish Fork City emergency responders and Intermountain Healthcare, and we have a mock safety drill that's taking place here where we have employees who have volunteered to be the injured individuals, and the emergency responders are going to come in and take care of them and take them to the hospitals and have a safety training and drill at their organization as well. So we're happy to have teamed with Spanish Fork City and Intermountain Healthcare. We've had a great day here at our safety day and glad to make the rest of the community part of it. I think it's great that Spanish Fork City reached out and that they want to improve the way that our first responders interact with companies, facilities, and in the community in general. Hydro has had a great relationship with Spanish Fork City over the years. We invite the first responders in annually to see our facility and look at what our process is and just be familiar with our facility so that they can, in the event of emergency, be able to respond and know some of our safety protocol here as well.
I think the importance of a community exercise like this, it brings us all together. In the event of a major catastrophe like this, it's not just the hospital, it's not just Spanish Fork EMS or Mapleton or Springville or Payson, it is everybody. We're here to provide a great service. We have trained professionals. I hope you never need us. But in the event that you do, know that this hospital is continually training, continually practicing, trying to learn those life-saving skills and enhance those life-saving skills that you may need at some point. And in time of need or a time of disaster, it's not about who owns what. We all own the situation. And how do we get our community back up safe and running the quickest way? And so I think that's what I hope that we illustrate with, and that we're good teammates and good community partners with everyone that lives here. No, I think immediately when you look at the day of the event, our emergency room on that particular day, we had a person that was an ICU, really, really sick person that we should transfer to an ICU. This was not a fictitious patient coming in for a drill. This is a real patient demanding lots of care at that moment when this drill kicked on. And this was a patient we didn't have an ICU bed to transfer him to at that moment, but we kept them here and we were trying to intubate him and keep him alive and keep what's going on right here in our emergency room. All of a sudden we get a hit with 12 to 15 patients and be able to determine who's going to a burn unit, who's going to go to Utah Valley, who's going to go to Mountain View, who are we going to keep, who are we going to immediate surgery. And our team in the ER just functioned immediately. We kept a doctor and a nurse sole with that one patient who was needing that care. We also had 6 other patients, live, real patients, in our emergency room when this happened. That's the glory of doing this, is that when emergencies or disasters happen, they're not going to wait until you have a totally empty hospital, fully staffed, just waiting for the emergency to happen, right? It's real time. And I think our ED crew, our emergency department, our ED crew did an awesome job. And to be able to have what was going on real life with real patients, and then to have an additional 12 to 15 fictitious drill type patients come in. And so I was really proud of that. And it just kind of gives me a good sense of, in the event something happens, we can multitask and we can take care of different groups of people. And that's probably one of the shining moments for me that came out of this, is just to see how well prepared they were.
I would say some of the highlights watching and observing this was the care at which the employees were given. You could see the first responders as they came on site. You know, it was a new environment to them, so they were asking questions and being directed, but as they went to the employees, they were, you know, caring for them, and you saw them, you know, taking care of them and then taking them out to the emergency vehicles and showing that care in the response and the work that they did.
Yeah, this is a drill. I'm at Hydro. We're reporting an accident.
Can you tell me exactly what's happened?
We've had an explosion here at the facility. We have approximately 19 people injured, 2 of them serious, many of them with lacerations, bruises, burns, and some superficial burns.
Okay, and where can we respond to?
What area of the building?
Yes.
We need you to respond to the east side of the building, in the middle of the building.
Okay, I'm going to start getting this going. I have a few more questions to ask you. Okay?
Okay.
And is anything burning?
No, there are no fires.
No fires? Okay. Hold
No
on one
fires,
second.
just injured people.
Okay. Hold on one second. Is anyone trapped?
No one is trapped.
Okay.
We have 2 people that will need transport out of the building. Everyone else should be able to get on their way out.
Have you had any unusual odor?
No, I don't smell any gas or I don't appear to have a leak.
Okay. All right. We will get the fire department on their way. If you'll just stay on the line, I'm going to initiate the dispatch, okay? Hold on just 1 second.
Okay.
Okay. Ambulance 63, Ambulance 64, Ambulance 102. Respond on a medical at Hydro facility.
Do you know how many ambulances will be responding?
I have 3 ambulances that are heading there right now, and I've just paged them over the air. So as soon as you can see them, let me know, okay?
Great.
So do not touch or pick up anything, okay? Do not use, turn on, or turn off any additional electronic devices. If it's safe to do so, leave the building, close the doors behind you, and remain outside, okay? And also, do not use any elevators, okay?
Okay, I can see ambulances approaching our property.
Okay, if you can go ahead and flag them in, okay? And I'll go ahead and let you go.
Did you tell him loading patient 1? Incident command from Central, 15 minutes on scene.
Our patients, are they on their way to Stanford Hospital or to Mountain View Hospital? To Stanford Hospital. Stanford Hospital, copy.
Doc's killing you? Started moving it. Okay. Hey buddy, can you tell me what happened?
I was going to my car, and I fell down. I hit my knee.
Hit your knee? Okay, yep. Someone's gonna be here in just a second, okay?
What are you saying?
Hey, it's EMS, we're here. Can you tell me what happened?
An explosion.
Okay.
Fell over.
More people are on the way, okay?
Okay.
Alright, we're gonna get you on here in just a second, alright?
Trying to get you up. Is there any issues with this leg?
No, it's fine. It's just this one hurts really bad.
1, 2, 3.
Put
Put any weight on that leg. Okay, that's gonna hurt.
Copy this to the scene. Copy it. Any else on that field?
Yeah, that's enough right there. You want to control that side? Alright, buddy, we came back for you.
Thank you.
We're going to put weight on your left ankle.
I can't put weight on my left ankle.
It's going to move a little bit. Be careful. Alright. You guys
I'm at 6:30. Copy. Central ambulance 4 has been moved to the hospital. Copy.
Dispatch ambulance 102 arriving at Mountain View Hospital.
Ambulance 102. Copy.
Are we out?
I had only 2 of these type that were left. I said that he doesn't feel he can pass up.
Unit, we have a request from Spanish Fork Hospital. They need 3 patients transported from Spanish Fork Hospital to another facility.
Good morning. Thank you for being here. My name is Nick Porter, Nickporter. I'm the Public Information Officer with Spanish Fork City. And this is a report on the drill, the full-scale exercise we had this morning. At approximately 9:30, an explosion was reported at Hydro Extrusions in their casting house. 3 ambulances, fire and rescue, were then dispatched to the scene. Upon arrival, they found a number of injuries, 20 injuries that were reported. At approximately 9:50, the first transport left with a patient in critical condition that was transported to the Spanish Fork Hospital. An additional 10 to 12 patients are currently in critical condition and being transported to Spanish Fork Hospital. 3 patients have been life-flighted to the Intermountain Medical Center in Murray from Spanish Fork. 8 others are in stable condition. Our crews, along with Mapleton City, responded. 4 patients were transported down to Mountain View Hospital. There's currently no fatalities in this exercise. We're grateful for that. We will continue to monitor and update as things change. We'll get an update from the hospital. No, we currently do not have any information on the cause of the explosion. It did occur in the casting house at Hydro, but are unsure of the cause of that. We will look for more answers with that and get some details from Hydro for our next press conference, which can be expected in the next hour or so. But at this time, that's all the information we have. Thank you.